Firstly, I always recommend to use ice bags because ice bags reduce pain, reduce hematoma occurrence, and it usually really fast and good decision post-operative. You don't need to fear if there is a little bit blood on the ice bag. You don't need to fear that still you're a little bit swollen. It always need to put ice bag 15 minutes on the eyelids, 15 minutes in the fridge. And like this, this algorithmic stuff you must continue for whole evening, and the best the next morning until noon. We always provide painkillers, but usually if person use ice bags, then it's no need any anesthetic, and it's no need any medication for the pain. It is the best if the patient put extra pillow for the night, because natural gravity works still, and after surgery all unnecessary fluids get down, not on the operation field. So for this reason, for the better visual effect, for better pain relief, it's better to put extra pillow. So basically all algorithmics are the same. You're putting the ice 15 minutes in the fridge or freezer. If you have freezer, then put in the freezer, and like this you continue until the noon. You don't need to be scared of bruises, it's normal. You don't need to scare of a little bit swollen around the eyes, it's normal. And of course there is blue spots sometimes in lower eyelid. Of course we don't operate this area, but still it's possible to have blue spot in this. And just put bag of the ice on the top of the ice, like 50 minutes on the ice, 50 minutes on the fridge. If you feel the like sand in the eyes or something like this feeling, I always recommend to apply eye drops. It usually make the eye more comfortable and make it easy for everybody. Actually, for the best result, I always recommend to have ice bags with the gel inside, which one normally use when you have some trauma. You put on top of that to reduce the swelling. So same for the eyes. These bags you can apply through the small tissue like napkin, and use like change the napkin, and that's it. If you take something from your freezer, like I don't know, like meat loaf or something like this, then you must put it on your towel, like normal bath towel, and then apply on the eyes. And with this you mustn't apply more than 15 minutes. Actually it make really huge differences, and the main point is that the patient feels less pain. Second, the tissue don't get so swollen, and they always are in better shape, and actually in the end you have a better looking scar. Of course we're operating the eyelids, not eyeballs, but we always recommend eye drops for the eyes, because naturally after surgery tears not forming so frequently, and for the first 2 days it's essential to have eye drops. I always recommend not to use mobile at first days, like not for scrolling or texting. It's much better to look TV or something when you don't need to look down, because when you're looking down with your eyeballs in this position, you always press a little bit your eyelids, and you can get more hematoma, more blue spots. We always recommend to use all cosmetics in the next day, not on the same day as the surgery. In the next day you can use with cosmetic pads to clean your face, apply something, new cream, etc. Just don't go near to incision site or plaster, which one is on the top. The plaster must be always dry. Hematoma or bruises or swelling disappears in the first 2 weeks, Actually, it's always individual for person to person, and normally for the vast majority it disappears at the 10th day. And actually there is some individuals which want, blue spots could stay for 2-3 weeks, and it could be normal. Actually, it's possible to have not symmetrical eyes at first, in the first days after surgery. Normally, until 3 months, we don't recommend to ablate them, because it's still healing process, and just after 3 months you have like 18% your final result. So please be patient and wait until 3 months. Normally in plastic surgery, I always recommend for all of my patients check themselves after 3 months. 3 months is the best time, because normally all swelling is gone, the scar forming is already in the hallway, and you at least can see your 80% of final result. But it's still not 100%, it's just 80%. For some people it could still be a little bit swelling, a little bit asymmetrical stuff because of the swelling. So keep it in the mind that normally it is okay to check yourself after 3 months, but final result after 1 year.